In the various aspects of eye care in the program Aware and Care, we've covered varied of topics, but yet there's so much about the eye that we want to know. They say the eye is window to the soul, and this window has so many nuts and bolts that we need to know more about it. In this program today in Aware and Care, we'll talk to Dr. Ambika Nair, who's the co-founder and chief consultant at Santhigram Group of Companies, and understand more about eye care. Dr. Nair, welcome to the show Aware and Care.
Namaskar. Thank
Namaskar, doctor. I was just mentioning about the eye. The eye consists of various parts, organs, arteries, veins, and all the other parts, which if I try to talk, maybe not nice, but we will be asking you questions more about it. They say the eye consists of primarily 7 parts, but in that retina seems to be the most important one. Well, I can't say that is important and this is not. But there are certain diseases and conditions related to the retina that can cause blurred vision and also eyesight loss. Today, we will talk about that, and I think it's called macular degeneration. Am I right?
Yes.
So, macular degeneration, let's start with the basics of understanding what is macular degeneration. What are the different types that are there?
This is it's a side effect of the aging, I should say. Okay, age-related, so we call it as AMD also, age-related macular degeneration. So, how people will tell that, how can you diagnose that? It's easy to say that AMD and everything like that, because if you come in front of me and stand, I won't be able to focus on your face. I cannot see your face properly. Blurred vision. Because the macula is affected, the retina is affected, okay? Because in the, it happens in the small central portion of the retina called the macula.
Okay.
Because actually wear and tear will come over there, then only all this macular degeneration happens. Because the retina is the light sensing nerve tissue at the back of your, your eye. So you have to be very careful with that actually. That's why, anything, you feel anything like that, we have to take care of the eye more.
So how is it different from an eyesight problem that, myopia or hypervision? How do you differentiate that? How does a patient come tell?
I told you, because we will not be able to recognize the face. Another thing is that when driving, you will see the straight lines becoming like a bend in the lines. Okay, so you cannot drive, especially in the night tunnel. It's very difficult because the glare, you won't be able to. You will become blind. Okay, so I know, like a small light also, you will not be able to see it. You cannot see, the sight will not be there.
And you have this couple of times mentioned right now that it's an age-related thing. So
Yes.
viewers, I want you to focus on the information that is being shared, because we all will age at some point of time in life, and some of us are already in the process towards that.
Yes.
So somebody in the family or you yourself need this information to look forward to and understand how you can prevent this or what can be done when AMD is being affected or you feel some symptoms are coming up.
Yeah,
So
normally,
are these the only primary symptoms?
there are so many blurred vision will be there. Some people will get pain. And not only that, because who will suffer, that is also more there. Like not everybody will have. High diabetic patients will have blood pressure, like a high cholesterol. Any other, like some diseases, whether they have taken, even in cancer patients, we have seen that actually, so many other diseases will always, because you're taking steroids for a long time, because it is very common in all those people actually.
Okay, so I think you have just added a little more to that information, that it is not only age related, which used to be a primary concern at one point of time, but today all lifestyle diseases and other aspects could also affect the retina and cause the situation. So this is a gradual process towards eyesight loss,
Yes.
or there is a stoppage somewhere in between?
No. It's actually aging process actually. As we age, it also comes with us actually. And like we have seen that with obese patients, so much of obesity, they will have it, because with the people will sleep apnea also. Okay. And like if you smoke for a long time, then also it is there. Like if you consume a lot of saturated fat, it can happen. And so many times females are more affected for this macular degeneration. Okay. And it can be genetics also, because even children are born with that. Juvenile, and even in the youngsters also it is common sometimes, but not very common. We have seen cases. even
Yeah,
in
because
very
with
young
the
children.
changing times and the way our lifestyles have changed, every generation is coming with an aspect or a symptom 1 or 2 years earlier or a decade earlier than the earlier generation did. So, Dr. Nair, are there any types of it, or there's only one type of AMD?
No, no,
There's
no, no. There are two
wet
types,
and dry.
mostly wet and dry. Dry
Okay.
is very common, and symptoms are almost same. Like if it's but little bit dry means it is almost very common with everybody. I should say that in 80% of the people.
Mhm.
But the wet means like because there will be bleeding.
Oh,
Okay, so in the retina, that's why that is very hazardous, and you have to rush to the hospital at that time because it's very seldom only, but 10%, 8% of the people only suffer with that. But
so then
wet can
somebody has
also become like dry. Sorry, dry can also lead to wet
wet. Okay.
macular degeneration.
I was for a second under the impression that dryness would mean itching, or wetness here means bleeding of the retina. So
Yeah,
can a
bleeding.
person from outside see that somebody's eye is retina is bleeding, or is it visible, not visible?
It may not be visible. Sometimes the pressure will build up over there because there is oozing over there. No, so that's that it will be there, and some people will have like a red eyes also.
Mhm.
Okay, that can happen.
That can also. So
Yeah,
does
headache
it
will be
also?
there. Some severe headache will be there. So for some people, because I have treated like recent case, I have treated a lot of cases actually, because she was doing this treatment in India.
Mhm,
Then because she is very aged, actually 80, so
mhm,
she could not. But she knows that Ayurveda helped her a lot.
mhm,
So she came to me
mhm,
recently. Okay, so then we did the see like 1 week we will do it again after like the 6 months we will do for 1 week like that.
mhm,
But stop gap
mhm.
in between like sometimes 3 days also. But her visibility is restored. I should say that actually. Yeah.
So is there any particular body type that who get affected more? You always say
Kapha is
women with
more. Kapha is more actually.
kapha is
Kapha
high.
is the root. People will tell that you don't like kapha people, but kapha people I have seen that. Not only that, kapha, pitta, everybody can get it. But in Ayurveda, we have to see what is their constitution.
Mhm,
So which type body they have and why they are suffering. Root cause has to be taken care.
mhm.
Then we can treat them very, very fast.
Okay. So a patient comes to Shantigram already with the diagnosis or the reports of all that is required, and tried all different kind of treatments, and he's there at the doorstep of Shantigram. You're looking at the reports, you understand the body composition of also that person. So let's start off with the first step in the entire treatment, apart from knowing the body composition and reasons behind how this person got
Yeah.
AMD, led to AMD. What happens
Uh,
next?
Sometimes, see, old people when they come, they will tell that before I could read, Ramayan, Bhagavat, all
Mhm,
those things. The printed, like printed things, they cannot read it because it get blurred up.
mhm.
And then, now I cannot see my children's face. So these all actually, like a very nice symptoms they are telling. And we ask them also, we take the history very properly, since when this happened, whether they have gone to the doctor, whether they consulted, whether are they taking any drops, they are putting any drops in their eye, any other medication, any vitamins for your eye care. So we check into that actually without, like we tell them also, go for every, like 3 months, 6 months, these people go for the eye checkup also.
Dr. Nair, in so many episodes that we're talking about different conditions and symptoms and health conditions that we talk about, eye care has become so close to me now suddenly, because I know that eye care is an important part of our life, but so many diseases related to the eye, which could gradually lead to loss of sight, is such a painful thought. And when we see our parents go through that, it is even more difficult because we don't know when we will be reaching there. But to know and get this information is so important. Now, in the same context, I think many of us, due to lack of information or Google information, we tend to first put eye drops to clear the eyes. Please
No.
let's start and focus a little bit of that point of information.
No,
Right?
Madhavi,
Misleading.
that's a very good question. Actually, it's very dangerous. You must go to the eye specialist and get your eye checked up. Actually, they will diagnose you whether you have any glaucoma, whether you have any macular degeneration or any other problem. They will tell you, then you can come to us and we can take care of it actually. Because diagnose yourself, that is more important. Like, because some people will tell that, oh no, it was not that, important because aankh ka hai na, no, there is no issue like that. But eye, without eye, you will not be, see, think of people without, that blindness, like you can think that how much they suffer. So you are not in that group. So you will not be learning braille or anything like that. So think that you have to take care of your eyes. Please don't be lazy
Mhm.
to visit an eye specialist.
Specialist. Despite COVID and other restriction, age-related problems, insurance issues, all the other things, this is one thing that you don't want to neglect, my friends. You need
Eye.
to attend to your eyes immediately. Dr. Nair, there's also this little, I don't want to be profiling the community, but usually people do tend to share medicines and say, they tend to ask their friends and family. WhatsApp groups are filled with doctors, friend doctors who suggest information. And the leftover medicines are sometimes used because sometimes people feel they have the same symptoms and they can use that. So it's a complete no, and I think it's a common
Oh my
sense
God.
answer also
Actually,
that.
this is a very good question. You have become very good these days, Madhavi, I should say. See, people tell me, like, because, oh, we had this, so we were using that. But
Uh-huh.
it did not help. It helped for some time. But, like using, somebody's medicine, that is infectious actually. You should not use it, especially dealing with the eyes.
Mhm. This is very important that
I
you told.
I don't agree with that actually. I don't agree
We
whether,
don't endorse that. We don't talk. We don't want to encourage anybody to do that. First of
yes.
all, it's a big no. We are talking to Dr. Ambika Nair from Santhigram Group of Companies. Here you will get remedies, solutions which are natural, which are herbal, which will help you, which are not at all uncomfortable. Dr. Nair, a patient has come to Santhigram. We have diagnosed the problem. So what are the steps of treating it? How much time does it average take to see any difference in the treatment once the treatment
Because
starts?
you need constant care for the eyes actually. Okay, so it is not that you will be. We can only help.
Mm-hmm.
Like we tell that smart aging,
Okay.
graceful aging, so that you will not lose your eyesight. So we help for that actually, and there
Mm-hmm.
are so many homeworks also for them.
Okay.
Okay, so we do because actually according to the constitution, we do nasya for the like Panchakarma. Once we do means all the toxins are out. Some days,
Okay.
2 weeks of Panchakarma,
Uh-huh.
like they are like another person. So they will tell that, like I feel much better now. Once, like all the toxins are removed from your body, you feel much better with that. Even the pressure in the eye will come down.
Uh-huh.
And the Netra Dhara is done for them.
Mhm.
Netra Tarpadam is done.
Okay.
Anjanam is there. There are certain medicines which make, according to their need.
Mhm.
Then we put like we will put it in the eye.
Okay.
Okay, so that is called Anjanam, like how we put the kajal. So, but
Uh-huh.
these are medications. So
Mhm.
this all helps them a lot. Shirodhara will help them because
Mhm.
if it is with that, okay. Then some people will not sleep. They are so fearful. Oh, I got macular degeneration, then I will not sleep. As if something will happen. Nothing will happen. Don't get anxious because this can be, like these all can be handled properly. There is nothing like that.
Mhm.
Okay. But like some people they ignore it for a long time, and what will happen is that they lose the vision. Okay,
Absolutely.
ignorance is actually ignorance because they think that like because oh yeah it's not going to happen to me, so no, I'm not going to take care of my eyes. That is very bad, and what they eat also because we had to see that.
Dr. Nair, I think, can I add something here? Maybe many a times it happens that if the course of treatment is 45 days or let's say 30 days to make the calculation easy, people tend to stop continuing the treatment after 15 days, 20 days because they feel slightly better and they feel they can do it at, themselves also sometimes. I think that could also be one of the reasons where people tend to stop the
Yeah.
treatment between and again come back when it gets worsened.
Madhavi, actually, like it's not a must that they should come for 3 weeks or something, but for the eye problems, not more than 2 weeks we call them, okay, because we
Oh, wow,
cannot do
that's
this.
so easy.
Yeah.
That's so easy.
So, I told you, so maybe one week, if they needed only Panchakarma, we will give, otherwise we start with that. But, detoxification helps a lot, I told you. Then,
Mhm.
like with 2 weeks of treatment, they feel much better. They will tell that I am, see, like their reading improves.
Uh-huh.
Okay, they will tell that the lines, that bend in the lines are not there. So these all things they will tell. And in dim light also they can read if the light is not there. And recognition of color. That is also
Oh,
there.
color
Yeah,
correction also.
color they cannot, like they cannot see. Like if it is red, like bright, like some paint advertisements comes, the same way they will tell that, oh, it's not bright, it's not bright. But the color, that the color they won't be able to recognize actually. So these all they will tell that I am able to see all those things better. So
Mhm.
that itself is a positive sign.
Okay. Dr. Nair, you have mentioned about Panchakarma. So I want to plug in the Panchakarma therapy a little bit here because you have mentioned that once you start doing that, the body gets detoxed. So do you recommend Panchakarma on a general conversation level to even to regular patients who come for well-being checkup?
Of course, we do that. Actually, see, 1 week of Panchakarma means that you will be losing 1 year, so you become more young.
Okay, I'm coming
Like
next week.
when they do the Panchakarma, they will tell that, oh my, like now he's looking so different. He's looking so young, energetic. Because how it
Motivated.
all happens, the toxins what accumulates in the body, especially in the liver and in the
Mhm,
mind also. So it is a detoxification of the mind and body.
mhm.
So that helps a lot actually. Because the eye is also, because is the if you have a lot of mucus, that is kapha, so
Mhm.
that will also create a lot of issues.
And
Okay,
this
so
Panchakarma can be done any time of the year, or there is a specific
any,
time for a person
any
to do
time of the year we do it. Before actually it was done only in Kerala during the rainy season,
it?
because the rajas and maharajas only used to
Yes.
do this actually. Now it
Mhm.
has come to the public also, because their long life was more important
Right.
than the general public. But now it's, like everybody goes. You can see our politicians all runs to Kerala.
Everybody is there.
Yeah.
So, friends, now you also know the answer behind as to why most of the Ayurveda centers in Kerala or back home in India are so busy during July, August season, during the monsoon season. It is because there was a reason behind that. So, Dr. Naya, we're talking about AMD today, and I also wanted to check with you: does it happen in both the eyes, or only one eye, or it gradually goes to the other eye?
It starts with the one eye, but
Mhm.
it shifts to the both the eyes actually.
Okay. And,
Yeah.
and all the herbal remedies that Dr. Nair is suggesting in this program, friends, it is always depending on the composition of the body. And most of the treatments here are totally lifestyle changes and food related also. Dr. Nair, when we talk about AMD, we also will be talking about a diet that are required. But I have noticed in this particular the talk that we've had, regarding eye care, I have noticed that not every time have you mentioned that something needs to be put into the eye. It's only when it is required. When you take
Yes.
care of the external factor completely, I think the eye circulation and everything works. Can you add a little more
Yes.
to that?
No, because actually it's internally also, because actually, like age related. So it is like a degeneration, so naturally if when it comes to the bones, it is arthritis. The same thing in the nerve also it comes.
Okay.
So we know like internal cleaning means that itself will regenerate your body.
Okay.
That's why
So,
after the Panchakarma, they feel so, like very good. They
okay.
feel that I have more energy now.
Okay. Now let's also talk about a worst case scenario. A patient has come with complete loss of eyesight in one eye, and the second eye is all has started getting the symptoms. Is there a possibility to restore the previous eye, or it is left untouched?
No, complete loss means, we can try, but, like a complete loss, I will not tell that I will restore back. But, that I have given, like some patients are there,
Mhm.
even they are from New Jersey only. They came for the treatment because they came for their daughter's treatment. Then they asked, do you have anything for me too?
Uh-huh.
Then we have done. So she said that because one eye was actually like 85 to 90%, she was unable to see. But
Mhm.
she told that now she can see around 60-65% at that time only.
Wow.
Okay,
So
and
it is
so
10 to 5%, 15% hope
see,
that
if the cause, like if we can rectify the cause means it will be. But total loss, like if it was a, like wet and totally damaged means nobody can restore it. Even, like laser therapies are done. We get a lot of clientele, like, they will tell that, like 8 time, 9 time, like laser therapies were done. Wet cases, we get a lot of cases like that. And that is with even the cardiac cases also, like heart related cases.
uh-huh.
Okay, so they must have had stent or open heart surgeries and all. So such patients also comes to me. Then we
Okay.
do the eye therapies and they feel much better.
Friends, we're talking about AMD, and we see a lot of hope in this program that you can always visit Dr. Nair and her team and understand by having the first conversation there. Dr. Nair, let's touch base on certain food habits or certain foods that help in healing this problem faster. What kind of food should be included in our daily diets? Or
Milk, cheese,
Mhm.
it's very good. And like saffron, you can have a pinch of saffron in milk. That will help a lot.
Wow, okay.
And
Milk is any type of milk?
yeah, normal milk only, because that is according to constitution. So I cannot say which milk they should use.
Mhm.
Okay, so then like legumes are used. Then whole, like a whole wheat is good for that. Rice, basmati rice, brown rice, and in like vegetables,
Mhm.
amla is good. Gooseberry is very good actually.
Dr.
Vitamin C is there, vitamin E.
You were suggesting something that we are having on daily basis. I think what we are
Yeah,
missing is right proportions of these foods in our daily
yeah.
diets. And Dr. Nair, I also see somebody mentioning that if they have milk allergy, how do they use saffron? Can they use it in any other food?
They cannot use that actually.
So how do they use the saffron in any
They
other
can
form?
use in water. They can drink it, or coconut milk.
Okay.
So allergy means that is a kapha person. Okay,
Mm-hmm.
okay. So that is very good. And
Okay.
like sprouts are very good,
Uh-huh. So
because
this is
that
the
is
first
rich
time
with the
I've heard
vitamin
about
D.
saffron in one of in our program in Aware and Care, where it is so good and so important for the eye, especially in AMD. And if we use
Yes,
it in our daily diet, it helps to heal the AMD
yes.
condition
It will
very
restore.
well.
Actually, it will restore a lot. Of course, it is little costly one. If
Uh-huh.
you really care for your eyes, you can have it.
And then when the cost of the eye to saffron, there is no proportion to that. But then what is
Don't use
required, it
overuse.
is
Very little. You don't
very
need so much. Okay.
a pinch, a
And
pinch.
eggs, carrot,
Uh-huh.
pumpkin.
Uh-huh.
Yeah, all those things are very good for that actually. Our
And
Indian diet is very good. Only thing you have to eat it. People don't eat it. That's a problem. Okay.
the entire program, Aware and Care, is bringing awareness about the foods that are there in our homes and backyards and in the little farmers market around us that are available to heal our body. And that is what house.
And another thing is dark chocolates are good, but sugar is too much in that.
Okay.
Okay, so dark chocolates, if it is not, like so much sweet, you can consume.
Wow. Dark
That is
chocolate.
rich with the zinc also. Zinc is really more needed. Okay,
Okay.
zinc
Dr.
is very
Nair,
good for the
I
eye.
do understand that this is it's a degenerative disease, so it happens gradually. Now, what are the other things that could happen if once a person has AMD? Apart from eyesight loss, I know it affects the family, it affects the person psychologically.
Depression, fear.
Mm-hmm.
They feel that that is the end of life.
Mm-hmm.
Yeah, because they are, they are cornered. They cannot go out. They
Mm-hmm.
cannot see. So we should take care. Then their everything will be restricted, Madhavi.
Mm-hmm.
So they get into depression. They feel that they are aged because of this.
So it is a
Age is only a number.
yes.
Okay, you should not feel that you are aged. That's a graceful aging.
That's amazing. And I think, like in any other condition, this is one condition which also needs a lot more support, because we are talking about a condition which comes with primarily with age, apart from the other factors which Dr. Nair has mentioned at the beginning of the program. And many a times, Dr. Nair has mentioned the family support, and when they come for the treatment or conversations are also very important. Consultation is very important. And in this case, if the side effects of AMD is also depression and stress, that also needs to be handled, and any foods that could relieve the person of anxiety and fear.
I told you what all they can take, like they can eat a lot of all these things, what I told. Zinc,
That's
rich food, carrots and all those things. When they sit, they can have all those things. Eat good fruits, that is also very good. Banana is good. But
uh,
everybody cannot take banana again, I am telling you.
yeah. There
Okay,
are
because
factors involved
yeah,
in
if
that.
like banana a little bit is fine for everybody. That's not a big issue.
So friends, when you have the right diet, not only the condition for which you've gone to the doctor, there are a lot of substitute helps also which come with this good diet. It helps you mentally, physically, and of course emotionally also when you're feeling healthy. the world is an even more better place for us to be fighting our battles on daily basis. Dr. Nair, thank you so much for this AMD episode, but I want to check with you just before signing off. Is there anything else that you want to mention to our viewers today?
Ghee is very good actually. You can include little ghee in your diet. So don't overdo anything because I happen to say.
Yes, absolutely.
Yeah.
And this is a program on AMD, friends. You have just watched another episode of Aware and Care. We thank you for your support, your feedback. And of course, if there's any problem that you want to talk about with Dr. Nair, please feel free to email us or text us. We will take up the topic. There is nothing to feel shy about certain bodily functions. And that is what Dr. Nair here is to help. Thank you so much, Dr. Nair. We look forward to another episode with you on Aware and Care.
Thank you so much. Thanks a lot.